Business isn't just one person. You can't be an expert in everything. And often you'll find that people, particularly in health tech, are moving into areas where really nobody's an expert. I am a very data-driven decision maker, but the reality is sometimes the data's not there. So you also just have to trust your gut. A lot of people in these sorts of roles don't consider recovery time like an athlete just considers it part of their training, part of their lives. And I think sometimes we need to remember that you've got to have the recovery time so you can get back up in SiSU. None of us quite say it correctly because we're not finished, but it essentially doesn't have a direct translation, but it means to be really resilient in the face of adversity. That's such a good interpretation when you talk about preventative health. The beauty of having something very physical that you can opportunistically engage with people, that is quite unique. People doing a health check in their tea break at 1 a.m. because they work night shift. We hit 1 million health checks. Utilising the SiSU Health platform to deliver health checks was about 6% of the comparative cost of doing that through other means. We had a very good sort of foundation with joining the Digital Health London Accelerator because it helped us understand that context far better than perhaps we did. It gave us lots of access into health innovation networks. We've made it very low risk and very easy for somebody to try us, to pilot with us. And it takes approximately 7 years to develop a new medical device. So it's not something that you sort of go into lightly.
Hello and welcome to the next episode of Inside Health Innovation, the podcast for all those who are interested in how innovation can help improve our NHS and the wider healthcare system. We live in a world where small is considered better when it comes to digital innovation. But how about some bigger machines placed in your local supermarket or your library? How can they help us address health inequalities in our population? Today, I'm talking to Samantha Fay, CEO of SiSU Health. We will be discussing why she loves working for a fast-paced health tech scale-up, the importance of health checks for hard-to-reach people, and how health literacy can help reduce the burden on the NHS. Stay tuned. Hi, Samantha. Welcome to Inside Health Innovation.
Lovely to be here. Thank you so much for inviting me.
Yeah, we're very excited to hear about your product because in the space of innovation, which is full of sort of digital software style products, this is really different. So I'm really looking forward to find out more about it. Before we get started, though, talking about you and the product, I always like to understand from people who are working in the space of innovation what the word innovation means to them. So let's get started there.
Yeah, and I think that's such a great question because I think it does translate so differently for so many people. For me, it's really about reimagining. It's really about driving change. And that might be because you've identified a gap. It might be because you've identified a new need. And it doesn't have to be sort of super techy. It doesn't have to be super scientific. It can just be leveraging something that exists in a different way. It can be approaching something in a different way. So I think that's always really important to remember. It doesn't have to be super techy.
Yeah, no, absolutely. Nowadays, it's all about AI.
It is.
Whereas, as you say, it's not essential to go that extreme. There are lots of innovation examples which don't go down that way.
And I think in large populations in healthcare, sometimes you need to take those gradual step-by steps. The population isn't necessarily ready for a really sort of significant innovation and change sort of leap.
Absolutely. That makes so much sense, especially in my experience of working in the NHS. I've absolutely felt that people need to be ready, the culture needs to be ready, and indeed the organization needs to be ready for it. So it's such a good point. So tell us a bit more about your background into the world of health tech, but also your journey to becoming CEO at SiSU Health.
Yeah, sure. So look, I've got a really varied background and probably not a typical one for the CEO of a health tech business. So I actually started out doing sort of a mechanical and manufacturing degree, ended up in telecoms, doing sort of IT and process transformation, and spent the sort of the early part of my career really doing corporate roles, all sort of related to transformation, be that cost, organization, process, digital transformation. And I think I got to a point where I felt like I developed a really sort of broad range of skills. I went and did my MBA. I did a postgraduate diploma in strategy and innovation. But I felt like something was missing. And I think like many people in the health industry, I was looking for something with more purpose, where I could get closer to the user, closer to sort of the experience of what the business was doing, and really try to make a difference.
And do you feel like you have found that purpose with SiSU Health?
Yeah, absolutely. I think for me, there's two parts to it that I really love. Being in healthcare and seeing the impact, which in SiSU Health we can actually see every day in the data across our platform, but also being in a scale up. I just love the variety. I love the passion. I love the sort of purpose-driven team that we have, and also the sort of network that you're able to sort of move in as well when you're in that space.
No, I completely understand that. So tell me more about your life as a CEO. As we know, when you're sort of at the top of a fast-moving scale-up, especially in your case, organization, life can be uncertain, quite pacey. You're experimenting a lot, I imagine. What mindset do you think you need to succeed in that? Or indeed, what mindset do you carry?
It's so different for everybody. I mean, there's huge diversity out there in terms of if you look at people who are doing roles such as the role that I'm doing. But from a personal perspective, I think there are a few things that are just so essential. As you described, it's a roller coaster. So I think you have to be the sort of person who actually really thrives in that environment, who is able to sort of keep a level head as well on that journey, who has the resilience to really sort of manage that, because it certainly is. It feels like a sprint every day, but it really is a marathon. So you need to be able to manage that for yourself, but also for your people. And I think the final thing is that you've really got to have the confidence in your decisions. Often when really you don't know a lot about what you're doing because you're doing it for the first time.
Yeah.
So you have to sort of have the confidence, take those leaps of faith and give it a go. Yeah, I think those are probably the key things that I would say.
And if you do, as I completely agree, you end up taking these leaps of confidence, as it were, in certain decisions. How do you handle or cope when they don't pay off and they don't work?
Yeah, it's a really interesting question because I'm supposed to sort of sit here and say, you need to be kind to yourself. But the reality is you give yourself a hard time. I mean, you do sit there and reflect on, what could I have done differently? What could I have done better? Hindsight's a wonderful thing. I think the key thing is to be able to sort of move on and take the learnings. And sometimes, unfortunately, you repeat the mistakes if the context is different, but to try not to do that, obviously.
Interestingly, I gave a talk at a university about entrepreneurship. And I often had students coming up to me saying, obviously the audience was self-selected in wanting to become entrepreneurs. And the question that kept coming up was, I'm not an expert in something, but I see this pain point that I think I can solve. But, I'm fresh out of university or about to graduate. How can I really launch a business in a space that I've no experience in or I'm not an expert in? What would you say to those people?
I think what I would say is that a business isn't just one person. I think it really helps to have an underlying knowledge, and if not, to have the passion to learn and the motivation to learn. But, a business isn't one person, so you can't be an expert in everything. And often you'll find that people, particularly in health tech, are moving into areas where really nobody's an expert. Perhaps these innovations haven't been done before. So I think it's about having the motivation and passion and then being able to surround yourself either with people in your business or with people outside your business who can bring that expertise, and being really open to that sort of feedback and just saying, that isn't something I know much about. So how can I or my team find out much more about that? So no, I don't think you do need to be an expert. I'm sure there's lots of people out there who disagree, but certainly that's my experience as well. I'm not a clinician. I don't have a health background. I do have a passion for it, and I've been really willing to learn and surround myself with people who are experts.
And how do you feel about having a co-founder in a setup like a health tech business? So you talked about, obviously, you're not a clinician, but say you are going into this type of field. Some people come in with a clinical sort of co-founder. What do you feel like that's important or perhaps not essential?
I think there's lots of great examples where perhaps someone with one sort of functional expertise, which might be more towards the data or the software development or the sort of clinician expertise, and then somebody perhaps who's coming more with the business sort of expertise, works really, really well. And there's absolutely lots to be said for having a co-founder with whom you can, spend time, discuss ideas, get support, because it can be quite a lonely place to be a founder. But I would also say it's not for everyone. I think I hear as many examples in my network of where it hasn't worked, or perhaps it's worked for a time. And then as in many startups and scale ups, you sort of grow out and into a new phase. So I don't think there's a one rule, one size fits all, works for some and not for others.
So, in your time as the CEO at SiSU Health, what would you say have been your biggest challenges? And you also talked about obviously having a really varied background in your career. How do they differ in health tech, if they differ at all?
They do differ in the context of who you're selling to and what you're selling and all of the complexities around, parts of our platform is a medical device. We're dealing with people's personal data, their health data. So all of that comes with, real challenges for a small business that's trying to operate in a field that requires a really high level of maturity and compliance. And often I find we've sort of got one foot in either camp, that really sort of innovative, entrepreneurial, fast pace, but then we have to slow ourselves down to make sure we're doing the right things. So I think that's quite unique to health. But I think the other challenges of the growing pains, building a team full of the right people, making the right decisions at the right time, whether to sort of move fast, slow down, I think they are across any kind of startup or scale up.
What kind of things help you decide what decisions to take in those scenarios of dealing with those growing pains that you're describing?
I mean, I love data. So, I think for me, I will run multiple scenarios, simulations through spreadsheets, talk to the team, talk to as many people as I can before kind of making a decision to really be convinced. I've tried to think around the decision in as best way as I can. And again, coming back to that point of then having the confidence to say, I feel like I've thought about this in every way I can. Now I'm ready to move forward. Yeah, so I am a very data-driven decision maker. But reality is sometimes the data's not there. So you also just have to trust your gut.
Yeah.
Or find someone who's done it before. So that's also a reality.
Yeah, no, absolutely. You're a busy CEO running this scale up. How do you balance your sort of home life and work?
I think it's a great question because I think anybody who says that they balance it really, really well is probably not telling the whole story. I think we all have times where we have kind of peaks and troughs of workload and intensity. I think for me, it's being really honest with myself about, how much I can take on personally. And I am a personality that takes on a lot personally. I'm very lucky. I have a very supportive husband. We sort of work as a team, trying to flex, life in a way that sort of works and supports each of us. But I also have a team as well in the business, and we're all trying to do that for one another. So, it's putting in some almost rules as well. I try to have my downtime every weekend. I have a dog who's a big part of my life. He gets me out every morning. He's there nudging my hand off the keyboard at 6 o'clock for his dinner and a break. So I think it's also building in that recovery time. I saw a great speaker once who does a lot of work with athletes. And he was sort of saying a lot of people in these sorts of roles don't consider recovery time like an athlete just considers it part of their training, part of their lives. And I think sometimes we need to remember that you've got to have the recovery time so you can get back up in.
And what would your advice be to other female founders who perhaps don't feel confident enough to go into either entrepreneurship or sort of senior roles, or indeed are worried about that sort of work-life balance?
I think firstly, try to find out as much as you can about what the reality is of it. Because I think you hear a lot of perceptions, but there's nothing like talking to a range of people in that situation to really understand the reality. I don't have children, so the reality of me being in this role is very different from someone else who perhaps has a large family context, for example. So understanding how different people are balancing those things, I think, is really important. And it's not for everyone. And I think also perhaps sort of, being realistic about what will work for you and won't work for you at the different stages in your life is also really important. There are lots of different ways of approaching this, becoming involved, progressing through that kind of journey. So I think, again, it's just being really open as well to those opportunities and having a really open mindset to sort of grab hold of some of those, but also say sometimes it's not right for me, at the moment.
A lot of the stuff you've talked about is about going out there, experiencing things or talking to more people who are doing those things. How can a new founder, new innovator go out and find those people?
But there are so many great sort of networking groups, accelerators that people can sort of sign up for. So there's the more formal ones. So, there are digital health accelerators through the NHS, through various sort of health innovation networks, at all sorts of stages. So for those who are very early, there are lots of female-orientated accelerators as well. But I think there are lots of just more informal sort of networks for founders. There's many in London where they organise sort of meetups on a monthly basis at the pub just to have a chat. Everybody's welcome. And once you sort of start to gain access to these networks, you find more and more and more, and you find the ones that really work for you and really suit you. You've got to put yourself out there. You can't sort of sit, at a desk in your house, sort of doing all desktop research. You have to get out and talk to people and meet people and get involved.
So tell us a bit more about SiSU Health and what does it do?
Okay, well, I might start with the name because I think a lot of people look at the spelling and sort of, struggle with how to pronounce it. So it is, in fact, a Finnish word, SiSU. None of us quite say it correctly because we're not Finnish, but it essentially doesn't have a direct translation, but it means to be really resilient in the face of adversity. And I think that's such a good interpretation when you talk about preventative health and actually being in healthcare in general. But what we do is we're essentially a digital health business. We are focused on preventative health. We have a really interesting and different platform and a very particular passion for engaging people in health who perhaps don't typically engage or are quite hard to reach. So we have our sort of physical health check station that we formally call the SiSU Health Station. That is a health check machine. And then we have a range of software, apps, pathways, triage mechanisms to both self-empower people, support them in their own health journey, but then also to pathway into sort of next step interventions or into local sort of services to help them improve their health as well.
And you talked about how this station helps reach people that are otherwise harder to reach. How does that work?
So the beauty of having something very physical is that you can place it in locations where people typically live their lives, in workplaces, in the community, in pharmacies. So you can opportunistically engage with people. And what we found is that it has this incredible power to sort of draw people in a range of different locations, and for them to sort of do this self-service health check in their own time, at their own pace, no judgment from an individual, no difficult conversation about perhaps your weight or your blood pressure. So that is quite unique. It can be directed as well. So a GP, a pharmacist, an occ health nurse, whoever it might be, can also send people to the health station. But we just find the opportunistic nature of it is really unique.
And it's available 24 hours, I guess.
Exactly. So we work with both employers as well as with community, NHS, local authorities. And we see time and time again, people doing a health check in their tea break at 1 a.m. because they work night shift, and they are men over the age of sort of 40, 50 years old who we all know it's really difficult to get them to a GP, let alone to have sort of a self-empowered sort of health check. So, yeah.
And what kind of health checks does the SiSU station offer?
So really what we're trying to do is give people a very sort of clear baseline, increase their health literacy. So we're doing things like height and weight to give them their BMI. We're doing things like their blood pressure, body fat composition, so they can sort of get a gauge in comparison to their BMI, as well as a range of sort of key health risks. So it's something called Q risk, which is about your risk of having a heart attack or stroke. We look at diabetes risk. And then actually the platform is very customizable. So we can configure it to ask all sorts of questions to determine all kinds of risks. So sometimes that might be around alcohol, activity, nutrition. Really, the list is endless.
And are you able to customize based on the region and what's prevalent there?
Absolutely. So, down to the very detail level, we can customize every single machine. So what we do is we work with our partners and with our clients to look at, well, what is the population they're trying to engage? Are there particular health priorities they're trying to address? And how do we therefore set up really sort of highly engaging journeys to capture those individuals and then to pathway them on? So, good examples of that is often hypertension. So blood pressure might be a particular focus in a particular demographic. But we also have some areas where mental health is also a really sort of key concern. So we ask some questions around mental health and weight, smoking cessation. Really there's a whole range of different priorities that we're trying to address.
And how many tests has the various stations been able to do so far?
Yeah, so to date, across the sort of UK and a little bit in Europe as well, primarily, we've done over 1 million. So we hit 1 million health checks around sort of September, October time. So it was a really big milestone for us. That represents over 500,000 people who essentially have done those health checks with us, who have gained literacy, who have had an additional level of support really to improve their health. And we do see lots of people improve their health.
Once I've done my test using this station, what happens? Where does my information go? When do I get to see it? Or when does my GP get to see it?
Yeah, absolutely. So as you do the health check, you will be seeing it immediately. So you'll be getting your result, you'll be getting a recommendation, and perhaps a signpost or a pathway to the next step for you. Once you've completed your health check, you'll receive an email pointing you towards an app or a web portal. You can sign up, make an account, and then you can track all of your data forever through that web portal or app. So hopefully people will repeat their health check multiple times and really be able to start to build up that tracking of information. Depending on where you are, there's also then the potential for you to consent to pass that health check data on to a health professional. That might be an occ health nurse at work, it might be a pharmacist in the local area, it might be a GP. It will just depend on what that particular setup. So you are very much going to be able to sort of get that onward support as well.
How would you quantify the benefits of having a station like this or having this solution in place for the NHS?
I think for the NHS, there are so many ways of looking at it. So we always sort of start with, well, the number one benefit is engagement. So about 70% of people who use the SiSU Health platform aren't regularly engaging with health. So you've got this almost black hole of the NHS, and people, particularly who are living in highly deprived areas, who might come from ethnic minority groups, where also there's just not such a high availability of perhaps primary care services. So it's really accessibility and engagement in the first place. Second, you're really increasing people's health literacy, and that is the first step towards people being empowered to sort of manage and improve their own health. Then because we collect so much data and we see so many people come back to the health station, we can show how many people are improving their health, how many people quit smoking, how many people lose weight, how many people reduce their blood pressure, reduce their risk of heart attack and stroke, which ultimately then reduces the burden on the NHS. Those heart attacks aren't going to happen in the future. The final one really is around sort of productivity, but also reduced sort of visits to the GP. So we have this balance of people who use the health station, who now have a level of assurance that actually, they are relatively well and they don't have the health risks that perhaps they were worried about. So there's no need for them to visit a GP, and they can continue to monitor themselves outside of the GP. But then we also have the people who really do need to see a GP soon, because we have identified, really quite a high level of risk. So, there's two sides of that benefit as well.
That's a lot of different, as you say, aspects of benefits that something like this can deliver. Have you or your sort of current customers in the NHS been able to quantify this in any one particular area or system?
Yeah, and I think for everybody who's working with the NHS, particularly in the innovation space, they will know that having the sort of evidence is such a key point. Thinking about those NHS decision makers who are having to look at evidence and having to put together those business cases to get funding. Part of our challenge, to be honest, is we have so much data, is trying to take that data and develop it into those evidence sort of examples. Look, we have multiple case studies. We have our health economics. We have these sort of data-based cases that I just talked about. But there's always more that you can do. So we're always adding to that. We're always working with different councils, NHS, to really build on those sort of reports, evidence, business cases as well. You don't think you can ever stop?
No, indeed. These are the kind of tests that the NHS would offer, especially to those over 40 or otherwise. But you're obviously now delivering them through this self-service portal. What is the difference in cost to the NHS of using your system versus what they would do traditionally?
I mean, obviously, doing a self-service health check on a digital machine is significantly lower cost than having to visit a nurse or a GP or a health professional to do your health check. So we recently had access to a report done by Southwark Council, and they estimated that utilising the SiSU Health platform to deliver health checks was about 6% of the comparative cost of doing that through other means.
94% cheaper.
It will depend on what other model they're comparing it to. But if you think about typically cost of a full NHS health check is estimated to be somewhere between £25 and £30. If you think about that, half of that goes to blood test pathology. So let's just sort of ignore that half. You're looking at, less than 10% of that cost to come at it from a slightly different sort of viewpoints as well.
Wow. So when you take that evidence and obviously what could be clear savings as well as engaging hard to reach audiences in the population, what is the kind of feedback you're getting when you go to different ICSs or different local authorities? Are they keen? Are they sort of raring to put the stations out everywhere?
Look, I think it falls into two camps. So those that we work with who have the platform across their communities or across their NHS locations, they love it, they support it, and they are quite happy to come onto webinars like we had last week and tell everybody about it, which is obviously amazing and brilliant for us. But then I do think you have that camp who perhaps that broader context of taking some of those healthcare components into the community, whilst the theory of that is well understood and it's all through the NHS long-term plan and the recent reports, that the practicality of how they do that and how health is offered perhaps out of their hands is still quite a challenging change context. And I think we're still working through that, to be honest.
Yeah, no, that makes perfect sense. So the NHS is quite big on co-production now with the people who are going to be served by a solution. Have you had patient involvement at all in the production of the solution?
And I really like actually the use of the word citizen, because not everybody who uses the platform is a patient. But yes, so our users. So that's constant for us. We get data and feedback from every health check that's done. We understand where people sort of drop out. We understand a score out of 10 that people give us at the end. And then we have multiple different ways of engaging our users to get feedback and also to test with them new features, new ideas. A really great example is Southwark Council. So sort of working in partnership with them, we did a whole range of different surveys. They organised to go out to locations to talk to people in person. Or we sort of tend to do a lot of just watching as well. People use the health station, ask them about their experience afterwards. So yes, it's a really big part of what we do and sort of constantly part of us striving to improve as well, both the accessibility but also the impact that we can have.
One of the key sort of differences of SiSU Health is having this physical piece of kit.
Yes.
And obviously that's helping in many ways, as you already described, in sort of engaging harder to reach citizens. However, is it challenging to have a big physical piece of kit as part of your business?
Yes, it is. But I guess we've been dealing with that for a long time. But there are realities. So it is a medical device.
Yeah.
And with that comes obviously investment in all of those certifications. We work with the NHS, so we are constantly striving to meet best practice, whether that's Cyber Essentials, DTACT, DSPT, the sort of whole range of frameworks that we're looking to make. Exactly. There's also the challenge of, they are physical pieces of kit. They're actually very clever computers and very robust and resilient, outer casings, if you like. And they are sitting in public locations. They're in the foyer of a leisure centre being climbed on by, children and all sorts. So they have to be very robust. So we have developed, very sort of core processes around how do we manage all of that. But it's absolutely worth it because of what I described earlier about the sort of power of being able to be in the community and engage people who otherwise might not be engaged.
And would you say when SiSU Health started, that was always one of the core aims, to have this physical product at the center of it all?
Look, I think there were two key learnings that came into the founding of SiSU Health, actually, that led to the birth of the SiSU Health Station. The first one was that it's very difficult to engage people with an entirely digital-only platform. So, there are lots of amazing apps out there, and one of their key challenges, well, how do you tell people it exists? How do you get people who need it to your app? And the second one was self-reported data. So there was a real sort of learnings from previous sort of business experience in this space that people don't really know a lot about their health. They underestimate their weight, they overestimate their height. So actually,
You sound like you're describing me.
but it's really important to get that sort of that really accurate data about people. So those were really the sort of two key reasons why actually the health station was born.
Is it hard to manufacture something like that? And how do you innovate on something which is, a product that needs to sit there, take these tests? Have you had to make any changes over time?
Now, I read a stat somewhere that said it takes approximately 7 years to develop a new medical device. So it's not something that you sort of go into lightly. And yes, manufacturing a medical device that needs to be robust enough to sit in a public location, really just with a mobile phone signal and power, and sort of weather protected, does come with its challenges. But I guess that's something that we've been learning for many years. We've got pretty good at it. We are constantly sort of challenging ourselves as to whether we should be adding new pieces of hardware, new sort of health risk aspects to the health station. It comes with all sorts of bits of clever kit as well. So they have a camera in them, they have barcode scanners in them, they have top screens that play videos, audio. They have the self-service sort of touchscreen that actually runs the health check. So there's actually so much more that we could leverage the health station for just now, actually, that we're not leveraging it for. So I think it falls into two parts. We can innovate within the machine as it exists today, and then we can also expand on it, but always being mindful of making any change to a medical device. It needs to be extremely well thought through, planned, and there are all the kind of compliance steps that you have to go through as well.
And in terms of this device, is it the same for every client, corporate or the NHS? Does it look the same for all of them?
We have two devices. One we fondly call the Health Station Max, one we call the Health Station Mini. They are exactly that. So we will use the larger format machine in the more public locations. It's more sort of visual. We can apply branding. We can play different videos according to where it is, the messages people want to share. But then we also have the Mini. It's pretty new to market. It's essentially the size of a sort of desktop computer. It comes in a really sort of hard case, and you can put it in the post, essentially. So more remote locations, we've had it on an oil rig, where you want to sort of send it to somewhere that perhaps there's a smaller number of people, but you really want to get that reach. That's a really nice alternative to the larger format as well. And then, as I said, we configure and set them up for every single client location, so that absolutely maximizes that local ecosystem as well.
Yeah, that sounds fantastic. And as you say, hindsight is a wonderful thing. If you were sort of starting off in as SiSU today, with the hindsight of everything you've learned in your time there, what would you do differently?
Oh, it's such a great question. I'm not sure we've got time. I think people is always a really challenging space. And I think when you're in a scale up, a startup or a scale up, making the right decisions about people is so hard. So do you grow the team now? What sort of people do you bring in? Do you bring in slightly more junior and, let's be honest, lower cost roles? Do you bring in more senior people? But are those more senior people happy to, roll their sleeves up? And so I think I would probably look back on some of the people in team decisions and really sort of think about whether perhaps we went too early on some roles that we really weren't ready for, and perhaps other roles we could have gone sooner and built the team up.
Yeah.
I mean, people are so important to any business, right? Getting that right.
And what about funding? So, obviously the kit needs investment, as you say, the team needs investment, and now you're in scale up mode. How are you funded as a business?
So we are revenue generating. So obviously we invest a lot of our revenues back into our growth plans and also into our innovation. But we do also have a range of wonderful shareholders who support our business. We did a small raise sort of early last year. We're currently out in the market looking for new strategic investors as well. I think it's a cool part of a CEO role. You've always got to be thinking about funding, and you've always got to be open, I think, to lots of different opportunities. We've been really lucky to win a couple of grants. So the Health Technology Adoption grant through working with one of the ICBs. Recently, there's been some sort of CVD workforce health check pilots that have kicked off. But you have to sort of look at funding overall. So we're very lucky to have a supportive range of shareholders and hopefully new investors in the future too.
You said you recently raised some funds as well. What do you plan to use them for?
So we sort of have two key parts to our sort of funding. The first one, and is a really nice problem to have, is that we can't meet our sales pipeline. We need some investment to unlock being able to essentially serve all of the amazing potential customers who are currently coming to us, looking to roll out the SiSU Health platform. And the second part of it is facilitating growth. For us, that's continuing to grow out our proposition, particularly in the NHS and local authority space, but also continuing to improve and sort of build out all of those sort of scalability aspects that you need to think about in a business.
It's interesting because I suppose many products, or digital certainly products, and digital innovators that I speak to in this space often are trying to prove their case or prove their outcomes in the NHS space before they go to perhaps the corporate world or insurance and so on and so forth. Whereas I understand your story is quite the opposite. You've done the corporate and insurance side of things, and now you've been kind of pulled into the NHS.
Yeah.
So tell us how you got pulled into it.
It's a really interesting journey that we've been on. So you're right. We started out in corporate health and well-being. We still today have a great range of long-term insurers and corporate clients that we work with, delivering employee health and well-being solutions. But coming out of COVID, we really found that model about sort of placing our platform in really accessible locations was starting to really sort of flow into the local authority and NHS space. We were being approached by sort of far more colleagues in that area saying, well, how could we roll this out within the community? We actually then joined the Digital Health London Accelerator as well, which gave us the opportunity to really sort of take some time to understand that space much more. And we've been growing in that channel ever since.
And how is the traction in the NHS for you at this point?
I mean, we've just seen the momentum grow and grow and grow, to be honest. I think coming out of COVID, that acceptance of self-service models, really sort of bringing to life the NHS long-term plan, the aspects of it that involve prevention, bringing healthcare back into the community, empowering people, that's just got a new sort of impetus. I think with the new government, there's far more impetus even again around those sort of localized prevention services, really understanding what will help us drive productivity, really release some of that NHS burden. And I think we've also got to the point where, coming back to what we talked about earlier, lots of case studies, we've built up that evidence base. So now it's quite easy, I think, for either councils or ICBs to look at other clients and say, we can see it working there. We can look at the evidence. This is something we'd also like to do.
Many innovators in this space often struggle with the complexity of the NHS. And I have a background in the NHS, and there are definitely still parts of it that I struggle to understand, and I find that I'm always learning. How have you, coming from perhaps not a non-NHS background, made yourself understand the complexity of working with the NHS and indeed sort of selling into that space?
I heard a really great sort of analogy from someone that I will steal shamelessly, which was the NHS is seen by many as sort of this big whale of an organization. But actually, when you look under the surface of the water, it's a shoal of fish. And they're all darting about in different directions. And I think that's so true. You can't look at this concept of the NHS as sort of a one organization. It's really not. Every region, every part of it, whether you're looking at sort of more local authority public health, whether you're looking at primary care, secondary care, social care, they all have such different stakeholders, priorities, funding structures, which does make it really challenging. I don't think I've met anybody who ever says they fully understand the NHS, because I just don't think you can. As a small business, that's a very practical challenge, actually. If I compare it to our corporate sort of marketing lead generation, for want of a better word, in our corporate space, we can sit down and we can, in quite a structured way, say, okay, this is our proposition. Who are our buyer personas? How do we reach them? Let's use a volume digital marketing campaign, or let's use LinkedIn advertising, or and you can sort of create a bit of a machine. Actually, you can't do that with the NHS. You sort of have to navigate your way, building relationships, identifying stakeholders, trying to understand the context of the problem, the priority that they're trying to solve right now, knowing it might change next week. So you just have to keep working at it. And of course, that's a huge amount of resource for a small business. So, we tend to flex up and down how much time we can put into that, just from a realistic perspective.
And what does that look like practically for your business in terms of that business development? Because you can do LinkedIn advertising, and you can do other types of advertising, but that, as you rightly said, it only takes you so far. So how do you make those networks? How do you make that happen?
It really is just hard graft. I think we had a very good sort of foundation with joining the Digital Health London Accelerator because it helped us understand that context far better than perhaps we did. It gave us lots of access into health innovation networks who themselves can sort of facilitate introductions, sort of help you build out that value proposition, that evidence. But at the end of the day, you sort of have to do the work. You have to identify the regions that are most aligned with your proposition and the problems they're trying to solve and the priorities and the funding. You have to constantly be horizon scanning to understand what new funding, grants, what's coming down the pipeline. You have to maintain those relationships. You have to go to the events. You have to produce the material. So there's no shortcuts, I don't think.
Oh, no, with the NHS, for sure. So that's all really helpful advice for people who are perhaps about to or trying to break into this market. What would you say to decision makers who you perhaps sat across the table from in the NHS? If you were sat in their space, what would you do differently, if anything?
I think it's finding a solution to that sort of problem of how do you grab hold of new innovations and new opportunities with one hand, whilst needing to justify business case funding with the other hand. Because the very nature of many of the innovations out there is they haven't had the opportunity yet to do the big study, to create the big case study, to produce all of the evidence. But if they're never given that opportunity, then they will never be able to. And I think that's a real kind of challenge, actually, for a lot of the NHS stakeholders who want to drive forward with any innovation, but the system doesn't necessarily allow for that to happen. And I understand one, this is everybody's sort of public funding, and we need to make sure it's spent in really robust and sort of proven ways. But we've got to find a way sort of through that. And what we certainly found with SiSU Health is that we've made it very low risk and very easy for somebody to try us, to pilot with us, to have one health station, 5 health stations through their community for a week, for 2, and all the data will suddenly, appear. And so we've really tried to remove the barriers to entry for our NHS and local authority sort of stakeholders so that they can really sort of gain access to that experience directly themselves with very low risk and very sort of low funding requirement. But not everybody can do that, of course, is that reality.
No, but that's a really good way to kick it off. So, Sam, you might have read the recent Lord Darzi report about the state of the NHS.
I know.
What do you feel when you read it?
I think it's so interesting. I think often it's as important the impact report has as what it says. So I think, the report really achieved one of its key goals, which was getting lots of attention and focus and discussion and impact. So that's great, because I think anything that brings focus onto improving the NHS and improving the health of our population is to be kind of celebrated. And then in terms of the actual contents of it, obviously for us at SiSU Health, we are very biased towards anything that talks about preventative health, bringing health more into the community, self-empowering people, because I do think that really has the potential to reduce a lot of the burden on the NHS so that they can focus on those other key priority areas that really need addressing. So, yeah, really, really welcomed it. And I think it will all be dependent on what the outcomes of the report, produce, what people do about it.
Yeah, no, absolutely. And obviously, there is a new long-term plan due in spring 2025. But as you picked up already, within sort of the landscape of the NHS, including the government, there's talk about perhaps sort of 3 key priorities, which include prevention, care in the community, and innovation and technology. It seems to me that SiSU kind of fits in quite nicely within those priorities. Do you see, therefore, quite a bright future?
I think for us, we just sort of keep ticking those boxes, if you like. And we really are seeing that momentum grow. I think what we also need to see, and probably the learning from the last NHS long-term plan, is it's got to flow through the system. So what we do find is that, because we largely work within the community, that is quite a difficult context to quite a lot of NHS systems and perceptions. So it's very easy to sort of look at something that's within a GP surgery or in a hospital and understand how that fits. But actually looking at something that sits out in the community, out in the wilds of the kind of local area is still taking some adjustment. And then how that can be integrated back into, for example, patient care records is still not fully thought through, because it is actually quite a new radical context, which it doesn't sound like it should be, but it really is.
Yeah. And how do you integrate if there is any integration that's involved more from a sort of technological perspective?
Yeah, so at the moment, there are sort of three options with the platform. The first one is for the person to share their data. So they have full access to their data. They can download that and share it in a myriad of ways. So that might be as simple as, they take their phone with them to the GP and they show their GP all of their blood pressure results. They can WhatsApp it, email it, whatever they choose to do, and whatever is sort of, private and safe for them to do so. The second method is we have an inbuilt sort of consent and referral data transfer mechanism. So that can go directly to a health professional. And then third, and what we're progressing right now actually, is having a more direct integration into GP systems so that the data from the health checks can flow directly into that patient record. So that will be available in 2025, which we're really excited about.
Oh, fantastic. And just take us back through the health inequalities issue, because that is quite key. And of course, with COVID, it became really pronounced how it already existed and of course was better recognized perhaps post-COVID. So tell us more about how SiSU stations are helping address that issue.
Many of your listeners might be familiar with the Core 20+5 sort of strategy and understand those populations that was targeting. And it's something that at SiSU Health we're really passionate about. And we've been very fortunate that we can have a real impact in that space. So as an example, we see in areas like Southwark and Luton, there really is a skew towards use far more than in the population by those sort of ethnic minorities, those from highly deprived areas. And really interestingly, and there's so much data available to us, but one that I really enjoy talking about is typically cohorts of people who use our platform and who have high levels of health risks give us slightly more negative feedback. That's not what they want to hear. However, we do have a cohort of users who sort of identify as Black Caribbean females who actually have some of the highest health risk we ever see in users, but give us the highest satisfaction rating. And I think that's so interesting because it's obviously a population who really welcome having access to that capability to be able to learn and to be able to be supported in their health, even though it's giving them essentially, to some extent, bad news about the level of health risks that they have.
So let's talk about the future of health innovation. Lots is going on in this space at the moment. We're both sort of been on different accelerator programs and meeting other innovators. What are the most exciting things you are seeing out in health innovation outside of your own business?
I think you can't talk about this space without talking about sort of data, can you? I mean, it's very difficult to talk about innovation in the last 12 months and not sort of mention, machine learning, AI. So, look, I think that's a really exciting space. Through the platform, we do collect huge amounts of data, and I'm really excited about a future where we can facilitate even more sort of predictive, preventative, and sort of nudging capabilities through the platform with a view to supporting people even more, addressing their behavior change even more so that they can improve their health, but also then to provide like really key population health insight that just aren't available today to so many of our local authorities and NHS for those populations that they're just not seeing on a regular basis. But then I think just more generally, it's really sort of addressing that sort of change challenge in the NHS. I think we've seen real movement around sort of, appetite for transformation, but we've just got to be realistic about, how busy the average day, hour is of somebody working in our NHS. And that does not leave a lot of capacity to change. So I think that's a space that, we all need to really keep working on to the sort of help facilitate bringing in some of these innovations.
NHS is arguably at that place where it has lots of challenges, including funding being one of them, and the sort of pressure in terms of demand. And therefore, the need for innovation is perhaps equally greater. How do you feel about being part of that landscape and trying to sell into this complex beast, which has its own challenges and perhaps not a lot of headspace all the time to think about?
Yeah.
sort of, taking on innovation like yours?
I really like to think about it as an ecosystem and that we are playing our part in that ecosystem. And I think even just in the last 6 months, we've really seen that level of collaboration and integration across those ecosystems really improving. So you may be aware that the Department of Health and Social Care has launched a new initiative, which is to deliver CVD orientated health checks in workplaces. So we're suddenly seeing this real coming together across the ecosystem. So the NHS funding local authorities to deliver health checks into a workplace using a platform like SiSU Health. And I think it's such a great example of that ecosystem really coming together to find ways to move the innovation and to move those sort of, outcomes and benefits forward in a way that's people are able to sort of adopt.
Yeah.
And not relying on just solely one part of that sort of ecosystem either.
And at SiSU Health, what would you say are your top 3 priorities in the next 12 months?
Oh, that's such a great question. Look, I think the first one for us is really just understanding how do we continue to manage that sort of growth path for the business and how do we continue to sort of serve our clients in a really focused and effective way. That probably encompasses all of the 3 priorities, to be honest. The first one and key role for me as a CEO is making sure we have a really resilient business. It is a difficult climate at the moment, so we have to balance investing for growth, but also maintaining a really sort of sustainable runway for our business. I think secondly, making sure we've got the right people in the business and that our people are thriving and growing along with us as well. And I think thirdly is keeping improving our propositions and our platform so that we can really continue to grow our impact as well.
And you've been on a few accelerator programs with SiSU Health. What would you say they've given you in terms of knowledge and skills when it comes to running your business and also working with the NHS, which I know some of it you've just
Yes, I'm really lucky. I've sort of seen it from both sides because I've also been a mentor across quite a few accelerators as well. Plus, we've been on the Digital Health London Accelerator. We've also been on the East Midlands Health Tech Accelerator and also the West Midlands as well. And I think what you sort of need to be really aware of is each of them has a very different focus and sort of set of priorities. So, for example, the work we're doing in the West Midlands space is very much around sort of manufacturing and really kind of moving our manufacturing sort of technology and approaches forward. Whereas working with East Midlands, it's much more about sort of evidence generation. Whereas the Digital Health London Accelerator is far more kind of what's that overall sort of value proposition and how are you going to approach the market. I think each of them come with significant benefit. You take away learnings, you develop networks, and you really sort of build out those stakeholder groups as well and gain so much understanding. But for anyone who's considering joining Accelerator, I would just say do your homework around which one's the right one for you and whether you're at the right time. Some of them are suitable for earlier phase, some of them are suitable for later phase. So yeah, no, I think they all have different benefits.
That's really great advice. And more generally and widely, if you were an innovator or an entrepreneur who's looking to start a brand new company within the health tech space, where would you tell them to start?
I think the first thing to start with is, do you understand what problem you're trying to solve with your product and how you are going to make money? Now, that doesn't sound particularly sort of, exciting to many, but those are the 2 things that will really sort of trip you up. People have great ideas, they have great technology, they have great innovation. But if you can't find that product market fit in the market, which in itself is someone who's willing to pay for it, then you are really going to struggle. And as a founder, that's a really difficult place to find yourself. Suddenly you've put a lot of yourself, possibly your personal finances into something, and you can't quite see your way forward. So I think those are really great places to start. I think there's loads of great resources available as well, just online, people you can talk to really help you sort of find your way through that. But don't sort of start out a business just with a bright idea unless you've really put some thought into that, because a few months down the line, when you've not earned any revenue, you will be wondering, what's next.
Absolutely. Well, with that grounding advice for innovators listening, thank you so much, Sam, for joining us today. It's been absolutely fascinating And I look forward to taking one of your health checks at my local SiSU Health station soon.
Great. Thank you so much.
Cheers. Thank you. If you would like to hear more fascinating stories like this from the world of healthcare innovation, please do like and subscribe to our podcast wherever you get them. And also, please remember to leave us a review. I'll see you next time.